Good morning, this is Dr. Natalia Carriage from Cumberland Family Chiropractic. Today I'm going to go over what actually happens when you come here as a new patient on your first visit. And I will give you a tour of our office, where you go and what we do. So first, when you walk in, you can sign in at the sign-in window and see Dominique, who will give you the paperwork.
Hello.
And instruct you on what to do and how to fill it out. Then you go and have a seat, where you actually fill out the papers. If for some reason you have to wait a few minutes while she's helping another patient, there is a lot of reading material that we have here on our coffee table that is quite educational about foods and supplements and orthotics and all kinds of good things for your health. Once you're done with the paperwork, you bring it back to Dominique. She takes it from you and gives it for me to review. Once I review it, I will come and take you into one of our exam rooms where we have a seat and go over everything that you put down, and we'll review your medical history, what's going on with you currently. I usually do an exam here, and we scan your feet here using the foot leveler scanner to see what's happening with your arches. It is part of our examination because we want to see how well your feet support your spine. Afterwards, we usually go down the hall so I can take some x-rays of your spine. So if you have some sort of a neck or back complaint or a history of past injuries and whatnot, we usually take x-rays to see what kind of shape your spine is in. Okay, so we don't miss anything, just in case. Then we go down the hall to the pro adjuster room, where I check your spine and show you the areas of misalignment. So pro adjuster is very popular in our area. I've been using this technology for 16 years. It is a way to see how your spine's aligned or misaligned, and usually I use it for treatment as well. So it's a little bit different than the traditional hands-on approach. Majority of our patients prefer this method versus the hands-on. So we check your spine on this instrument where you're seated here, and then I show you on the screen what comes up and what that means. We do not treat on the first visit because the first visit is the evaluation, where we want to gather all the facts so we can make an accurate diagnosis and come up with a treatment plan. When you come back follow-up, that's when I treat you here, and I explain to you all our findings, what the x-rays, the foot scan, and everything else shows. And then we establish treatment frequency and a plan, and I make other recommendations as needed. So that's exactly what happens here when you come here first time. The first visit is about 45 minutes to an hour, depending on what's going on with you, what kind of complaints and problems bring you here, and we do our best to help you and figure out what's going on and get you feeling better. So I hope everyone has a happy Thanksgiving for those who celebrate. Have a great rest of the week. Enjoy the beautiful weather, and we will see you soon. Take care.